ER nurses of Reddit, how often do all those "one more minute and I'd be dead" stories get exaggerated? One story I'll never forget is that of a family of six, two parents, two children, and two grandparents, who narrowly escaped a collective carbon monoxide poisoning by sheer luck. Everyone was asleep when the mother got up to use the bathroom and fainted on her way back to bed from the CO exposure. The sound of her fall woke her husband, who checked on her and called an ambulance. When the first responders arrived, their carbon monoxide detectors went off and they evacuated everyone. If she hadn't needed to use the bathroom, they would not have survived. If she had made just a few more steps and reached her bed without fainting, they would not have survived. If her husband had slept through her fall, they would have perished. If they had assumed the fainting was nothing and planned to see a doctor the next day, they would have been gone. Instead, I had them all in the emergency room, casually recovering from a moderate carbon monoxide poisoning, chatting as if this were just another unusual night, completely oblivious to how close they had come to making the local news the next day. It was eerie. We got our home most likely through a distressed sale, due to carbon monoxide issues. The former owner was an elderly man in his 70s who lived alone. He had bought the place before carbon monoxide detectors were mandatory. The central heating, water heating, stove, and oven were all gas-powered, and the area is seismically active. All we knew when we first saw the listing and met the agent was that the owner's son was handling the sale. The owner had collapsed, been found by neighbors, and was no longer able to live alone. As we toured the place with the inspector, we noticed the fan above the stove didn't work, a minor issue we could fix ourselves. The vent to the water heater had come uncoupled, a trivial fix. We snapped it back in place without tools in under a minute. Going through the bathrooms, which were right next to the water heater, we noticed soot stains on both ceilings, just on the other side of the water heater, as if exhaust had seeped into the rooms. It felt like piecing together a mystery. We bought the place and told the son what we had found. They hadn't determined the cause of his father's collapse, but maybe the information would help with treatment. One night, my fire alarm started going off around 1 in the morning. I got up, no smoke, no fire, so I reset it. It went off again. I reset it. It went off again. So I hit it with a broom handle until it broke. That morning, I went to Home Depot for a replacement, and the saleswoman said, "You have to make damn sure that wasn't also a carbon monoxide detector." I bought a standalone carbon monoxide detector that plugged into the wall, and it went off in minutes. I was told to call the fire department, and when they arrived, they said the Home Depot employee had just saved my life. One night, I woke up to my dog howling. I went to calm her, and once she quieted down, I heard a faint beeping noise. My husband came out to see why she was upset, and I said it was probably that weird noise and that I was about to figure out what it was. It turned out he had some extra carbon monoxide detectors from work that he had put in the garage, and our furnace was having a problem. We have a combination smoke and carbon monoxide detector in the house, but the extra one and the dog meant we could act before the house was affected. She got lots of treats from everyone. I have a story kind of like this. I'm a paramedic, and these days I mostly work events, sports, music festivals, concerts. I was working at an NFL game last season. We showed up pretty early for the tailgate as well as the game. Before the game even started, we were sent out for a cardiac arrest on the field. I work on the ambulance, but we also have non-transport EMTs and medics patrolling the stadium. So they responded before we could drive across the stadium to access the field. By the time we arrived, the patient was already up and talking to us. He was an older man who had apparently been given VIP tickets by some random guy in the parking lot, which allowed him to watch the team warm up before the game. He went down right next to the team trainer and an off-duty firefighter, so he received immediate CPR. The team trainer also had a radio to call EMS. They got him back after one shock. If he hadn't been given those VIP tickets and had been up in the stands, who knows how long it would have taken us to reach him. It can easily take 15 minutes just to walk from where we're parked to certain parts of the stadium. Who knows if he would have been around two people who were CPR certified and able to manage a medical emergency. Story 2. I'm an internal medicine doctor. I had a man come in after feeling weird in the chest all day. He was in his 40s, athletic, in the middle of a divorce, and stressed. His EKG looked okay. I see non-specific chest pain all day long, and it's usually heartburn, stress, asthma, or a strained rib muscle. I was so close to sending him out with some Malox, but there was something about him that made me send him to the emergency department. I asked if he wanted a wheelchair escort, and he said no, he'd walk. An hour later, I logged back into his chart to check on him, and the first thing I saw was a code note. He had made it to the ED, had blood drawn, and it turned out he was having a mild heart attack. While the doctor was explaining the situation and next steps, he suffered a cardiac arrest. They got him back immediately, which is about as good as it gets, having your arrest in an emergency department in front of an emergency physician. When I saw him a week later, he was doing great but told me he had almost gone to get some food before heading to the ED. If he had, his arrest might have happened in a Jimmy John's, and things probably would not have gone so well. In almost 20 years of practice, this is my closest call. My dad did something similar. My granddad fell out of bed trying to get to the bathroom early one morning and couldn't get up. He wore a personal alarm, and Dad was first on the contact list, so he drove straight there. He called an ambulance because Granddad was very cold and only semi-conscious. When Dad heard the ambulance pulling into the street, he went out to move his car and was promptly arrested in front of the paramedics. They resuscitated him, sent another ambulance to get Granddad, and Dad ended up getting stented within an hour of his myocardial infarction. He caused chaos in the cardiac unit by repeatedly removing his monitors so he could sneak downstairs to visit Granddad, who was hospitalized with a broken hip. He found it hard to believe he had a cardiac arrest because he remembered nothing about it. I went to the emergency room once with really bad chest pain that woke me up. It felt like heartburn, but much stronger and duller. I felt silly for going, but a parent convinced me since I was only 23 at the time. It turned out I had a severe case of myocarditis and pericarditis together. I was admitted with an abnormal EKG and a low ejection fraction. It took me 3 months to regain all my strength. Now, I never feel bad about going in for chest pain. Story 3. I once exaggerated a situation on purpose, and it saved my father's life. He woke up one morning feeling weird. No pain, no dizziness, just a persistent strange feeling in his chest and stomach. He said it almost felt like indigestion. After drinking some water with no relief, he asked me to drive him to an urgent care facility. About halfway there, he told me he was starting to feel dizzy and experiencing tunnel vision. Knowing his history of heart disease, I decided to go straight to the emergency room instead. When we arrived, the nurse at the desk told me to take a seat and that she would call us when ready. There was already someone checking in and a line of people behind them. I knew explaining the situation would take too long, so I pushed past and told the nurse that my dad couldn't breathe. That got him rushed past the line and into an open room, where he was found to be having a heart attack. 2 IVs, a crash cart, and a defibrillator later, he was stable. He was transferred to another facility, underwent open heart surgery, and has since made a full recovery. The doctor later told me that it had already been a razor-thin margin that my father made it, and if I had taken the time to wait in line or try to explain the whole story to the nurse, he would not have survived. I got mauled by a pack of dogs far out in the remote desert and had to be driven 30 miles to the emergency room in town. On arrival, I was wheeled to the back of a large crowd at the intake desk. After waiting patiently for about 30 seconds, listening to people at the front of the line pleading that their non-emergent issues be seen, I finally spoke up. Sorry to interrupt, but I've lost a lot of blood and might pass out if I don't lie flat soon. The crowd turned with angry indignation on every face, which quickly shifted to surprise as they parted. The 2 admissions nurses' eyes went wide at the sight of me, covered in dried and actively leaking blood on my head, both arms, and chest. For the next 10 seconds, I noticed the people in line mostly looked defeated and guilty. Seeing me in genuinely bad condition, I was promptly whisked into the back, which led to hours of surgery and days of recovery. Story 4. I'm not an emergency room nurse. However, I am a recovering acute myeloid leukemia patient. I was told early on that my prognosis wasn't ideal by very skilled and careful communicators. I picked up on my care team's cautious wording almost immediately. They never made statements like, "You only have a certain time frame." Making promises or definitive declarations opens them up to lawsuits, so they have to be careful about what they say. The only time anyone came close to saying, "1 more minute and you wouldn't have lived," was when I was preparing to have a bone marrow transplant. Unfortunately, testing revealed that my leukemia had come back with a vengeance. I remember the initial phone call with one of my oncologists after this new wave of cancer was discovered. He repeatedly apologized and told me that sometimes he needs to just sit in his car and scream in frustration. I can't imagine the stress he works under. I would probably scream in my car too while we discussed next steps. Reading between the lines, I understood clearly that no oncologist apologizes like that unless they feel they have failed. Years later, he disclosed that he was shocked I had made it to remission. Maybe I didn't, and still don't, ask the right questions in the right way to elicit a dramatic response. But this has been my experience living with a severe illness. I definitely don't ask enough questions. I'm a breast cancer patient, and I'll never forget an office meeting with my oncologist when she was trying to deliver horrible news. My short remission was already over, and my cancer had metastasized. I pretty much said, "Okay, what are the next steps?" She explained about more radiation and a daily chemotherapy pill for the next few years. I said, "Okay," because we had a plan. She then said, "I think you're taking this news better than I am." I replied, "But you have a plan." I took it to mean, "Yes, you're going to have to do more treatment. I know it's hard, and I'm sorry there's more to come when you thought you were done." It wasn't until years later that I realized she had been trying to tell me I was terminal, that my time might be limited to about 2 years. She just couldn't bring herself to say it directly. I suppose my mind never truly grasped it, and apparently, neither did my body. 8 years later, I've been off chemotherapy for 2 years and hope to finish the rest of my treatment in the next few months. Even oncologists at some of the best hospitals in the country aren't quite sure what to make of my case. I like to think it's because I never got the memo. Story 5. I got incredibly lucky. My roommate had just gone to bed, and I was up looking for a book to read. One moment I was standing by the bookcase, and the next I was on the floor. I got up, shook my head, and decided to lie down since I clearly wasn't feeling well. But after only 2 steps, I woke up on the floor again. This time, I called my roommate. He came out just as I was collapsing for the 3rd time. At first, I told him, "Just call a cab to take me to the ER," but when I passed out again, he called an ambulance instead. At the hospital, they discovered a large blood clot had passed into my lungs. I spent nearly a month there before being discharged, and it took several more months of recovery before I could do much more than walk to the bathroom. If my roommate hadn't been awake to hear me, he would have found me gone on the floor by morning. Then, at the start of this year, I was apparently walking out of the bathroom when my roommate stopped me to ask something. He said I told him to hold on a second because I needed to use the bathroom. When he pointed out that I had just come out of there, I argued that I hadn't and was on my way in. He said it was eerie. I was up and moving, but there was clearly nobody home. He called an ambulance, and it turned out I was septic. That meant another 3 weeks in the hospital. I've decided I'm keeping the roommate. Story 6. I recently had a patient brought in by her dad. She was peri-arrest from anaphylaxis. Her dad had been hesitant to use her EpiPen, thinking he was close enough to the hospital to drive instead of calling 911. On arrival, she had weak central pulses, no peripheral pulses, and a blood pressure of 50/30. She was just minutes away from a potentially severe outcome. We did a lot of education, and she ended up okay. If you have an EpiPen, know how to use it. Her dad was well-intentioned, appropriately worried, and stayed lovingly at her bedside as she recovered. This isn't meant to shame him. Emergencies look different for everyone, and allergic reactions can evolve quickly. She probably didn't seem that bad when he decided to drive, and it's not always easy to predict how serious something will become. But he got her to us just in time, which is what matters. Cases like this are rare, which is why this one stands out. She was safe. Her dad learned a lot, and everyone won. Story 7. I'm an ER doctor. It's extremely rare to see a patient who would have died if they'd arrived even a minute later. I've heard countless patients make claims like this, and in the few cases where it might have been relevant to their care and I had time to check, I've reviewed the records. In exactly 0 of those cases would waiting another hour have been fatal. Another day? Possibly. I've had only one personal case where timing truly mattered. A 40-something, generally healthy man felt odd and lightheaded with nothing specific. He went into ventricular fibrillation immediately after arriving, and we shocked him back. He experienced a few more fatal arrhythmias, but ultimately stabilized with additional shocks and amiodarone. If he hadn't reached the ER when he did, there's a high chance he either wouldn't have survived or wouldn't have walked out neurologically intact. I'm an oncology fellow, and I often think about stories like, the doctor said I had less than 3 months to live, but here we are 2 years later. For example, if a patient is newly diagnosed with pancreatic cancer and asks about prognosis, the typical answer is that if it goes untreated and is already metastatic, about half of patients pass away within 3 months, some less, some more. It's usually a skewed bell curve with a lot of nuance. I suspect many of those doctors said I wouldn't live. They're quacks. Stories come from remembering only a slice of the conversation. Honestly, that's fair. Expecting someone to process all the nuances in such a stressful moment is probably too much. I just tell patients I'm glad that wasn't the case. It makes me wonder if some of the dramatic ED anecdotes stem from an offhand comment, like, "I'm glad you didn't come in even a minute later." As an EMT, I feel my role is much more likely to involve true urgency. I once responded to a patient with multiple gunshot wounds who was heading straight toward a pneumothorax and bleeding heavily. I'm not sure it came down to the final minute, but he was well on his way to passing when we arrived, and in just a few more minutes, his circulatory system would have been depleted. Our first BP reading was 36/30, not perfectly accurate, but clearly extremely low. Those patient anecdotes about, "the doctor said if I had waited another hour I wouldn't have lived," always make me smile. I've never heard a physician make such a claim, nor have I ever made one myself. With the amount of boarding and waiting in modern EDs, they probably sat in a waiting room for hours anyway. That said, the closest examples of perfect timing usually involve patients who arrive and then experience a readily reversible cardiac arrest in the ED. I've seen a handful of type A dissections survive, but even they had more than a minute to live, considering the time needed to set up an OR, even emergently. Story 8. I'm a respiratory therapist working in the ER, and it's pretty common for patients to code in the ambulance on the way in. In these cases, though, it seems like they know immediately that things are bad and barely make it. One of the paramedics who taught my CPR class said that in our dense but geographically small area with 2 hospitals, the chances of surviving cardiac arrest are higher than average. They're usually on the rig and en route by the time the report is even given. I've also heard a belief that some people cling on until help arrives, and as soon as help is there, they let go. I have no idea if that's real or just folklore, but the idea is that even if the ambulance had been a little earlier or later, the outcome might have been the same. They'd still code once help arrived. Maybe it's just one of those old wives' tales? When I took an EMT class a couple of decades ago, they taught that people often pass away or survive based on what they expect. Soldiers with bullet wounds sometimes survive more often than civilians because civilians assume that getting shot is fatal. Another example involved surgery with a low survival rate. If patients were told that almost everyone the surgeon had treated survived, their odds of survival improved. Conversely, telling someone their chances were low could decrease survivability in acute situations. Even for lifestyle changes, framing matters. Warning someone they'll die soon if they don't lose weight or quit smoking can paradoxically help them live longer. The key takeaway was that instilling confidence, letting someone know you're an expert and that they'll be all right, can improve outcomes, while telling them they won't survive can be detrimental. Story 9. I was deep into diabetic ketoacidosis before I was first diagnosed with type 1. I was so weak I couldn't even make it back down the stairs to get to the ER after a doctor visit. I'd probably been in DKA for months before my body finally started to fail. My mother had left the state for the weekend, so I was alone and couldn't do anything. Thankfully, she came back when she did because the doctors and nurses said I wouldn't have made it another day. I spent almost a week in the ICU before being stepped down to the ER. My dad found me unconscious on the floor beside my bed. The last thing I remember from the night before was feeling incredibly weak, needing to pee constantly and trying to stand up, only to collapse because my legs wouldn't hold me. I caught an infection and went into severe diabetic ketoacidosis. By the time I reached the ER, I had developed sepsis and hypothermia. I spent more than a week in the ICU. The doctor told my dad that if he hadn't found me when he did, I wouldn't have made it. He was this close to not even stopping by my room, but something told him to check on me. It all felt surreal. I'd never experienced anything like it. I remember the doctor in the ER asking me questions like what year it was, and I couldn't answer. The last thing I recall was trying to stand, falling, and then hearing my dad's voice beside me, calling my name and stroking my hair. It was the only time in my life I completely lost track of time. No dreams, no thoughts, no awareness, just a blank space before waking up in the ER. Story 10. I was told that a few weeks after I was born, my mom noticed I was sleeping far too much. She already had 2 kids, so she knew something was wrong and took me to the doctor, who immediately called an ambulance. Apparently, I had septicemia, and my parents were warned it was touch and go, maybe even time to start making arrangements. My mom doesn't really remember it now, so I can't say how accurate it is, but I do remember the monthly childhood asthma attacks. Dad would race to the ER, sometimes running red lights and even getting a police escort, and I'd end up spending a week in an oxygen tent. Looking back, I can't imagine how stressful that must have been for my parents. It happens. I wasn't especially close with my youngest, but she was my 4th. And one day, around 8 weeks old, she just didn't seem right, too sleepy for a newborn, no fever, no obvious symptoms. Her dad kept insisting she was fine, but I said, no, I'm taking her to the ER. By the time we got there 30 minutes later, she did have a fever. A couple of hours after tests, it turned out she was septic from a kidney infection. We spent about a week in the hospital, but it was never a case of she would have passed if you'd waited another hour. It was more, good job noticing something wasn't right. Mom, glad you brought her in. Story 12. When my son was 11 months old, he started having respiratory issues. We called the on-call pediatrician, who explained the whole sucking in the abdomen sign and said to bring him in if it got that bad. This was around 9 p.m. on a Saturday. I stayed up all night with him as he coughed, barely slept, and wouldn't drink any milk. By 8 a.m., I took him to the nearest urgent care, but they sent us to another one. There, the PA gave him a breathing treatment. His oxygen level was at 82%. I had no idea what that meant at the time. The PA was completely casual, saying it was up to us whether to go to the hospital or not, showing no sense of urgency, so we didn't think to worry. We decided to take him to the hospital anyway and called an ambulance since it was 30 minutes away. Thank God we did. When the EMTs arrived, they were shocked at the lack of concern from the urgent care staff and immediately insisted we rush to the nearest children's hospital with lights and sirens. On the way, my son began to lose consciousness. It's been 4 years since that night, and I still get chills thinking about it. I'll never know what might have happened if different decisions had been made that day, and I'll never forgive myself for not taking it seriously sooner. We visited the hospital several more times after that, and he was eventually diagnosed with asthma. I will say we learned to take it seriously, and subsequent hospital visits caught issues much earlier. Story 13. I'm a lifeguard. While on vacation, I was scanning the water and counting a group of 7 small children, a habit I always keep up. None could have left the water unnoticed since they were on a sandbar, so I got nervous and went to check. Walking along the sandbar, I spotted something neon green beneath the water. I swam over as fast as I could and pulled a 7 or 8-year-old boy out. I ran him to the beach and gave him a back slap. He had a pulse but wasn't breathing. One rescue breath kick-started his system. He coughed up water and began to breathe. If I hadn't been paying attention or hadn't gotten up to check, he would not have survived. His parents were facing away from the water to enjoy the sun, assuming the sandbar made things safe. Out of all the kids there, only 2 could actually swim. Story. My dad had a food truck chicken sandwich years ago, in the 1980s. He was a long-haul truck driver, driving home from Quebec to the Maritimes of Canada when he started to get crampy. He pulled his fully loaded tractor trailer onto the shoulder of the Trans-Canada Highway and got out to urinate in front of the grill. He said blood was pouring out in his urine. He managed to get back in the truck and started again, but soon he felt severe pain in his lower belly, so bad he could not push the clutch all the way. He used the CB radio to try to get help, but being in Quebec, everyone was speaking French, and he did not speak French. He finally got one person to answer, and Dad told him he was not sure what was wrong and did not know where the hospital was or if he could reach it with the big rig. The man told him to take the next exit, whatever it was, and he would meet him with an ambulance. By this point, the man was running alongside Dad, having caught up to him. He had radioed dispatch, who called emergency services. Dad was growing weaker and could not bring the truck to a stop. The other trucker moved his box trailer in front of Dad. Dad, who had managed to gear down and never really reached full speed, deliberately ran into the back of the other truck, bringing his vehicle to a halt. An ambulance arrived, and Dad was taken to Campbellton, New Brunswick for surgery for a perforated bowel and blood loss caused by a chicken bone in the sandwich. The surgeon told Mom that Dad had been about 30 minutes from bleeding out if he had not reached care in time. It reminds me of my mom's story. She is a nurse and was on holiday when she was among the first on the scene of a crash. The child had nicked the femoral artery and the blood loss was rapid. The other bystander just stood and watched after calling 111. Mom asked a man for his belt and he said, "No, my trousers will fall down." His girlfriend looked at him and yelled, "Give her your freaking belt," and he did. Mom made a tourniquet above the wound, wrote the time it was applied, and waited for the ambulance. The paramedic said he would have passed in the minutes between the tourniquet being applied and their arrival. Story 15. I was a new graduate at the time, only about 2 weeks off board, fresh and working at a rural hospital. I had an evaluation as the last appointment of my day on a Friday for back pain. A woman walked in, and I could tell she was in far more pain and discomfort than what she had listed on the intake form. As we went through the evaluation, the dots for straight musculoskeletal pain were not connecting. Absolutely nothing I did reduced her pain. As I helped her roll to her side to sit up, I felt her heartbeat in her abdomen. My mind screamed, "It's an abdominal aortic aneurysm," so I politely escorted her to the emergency department below the clinic. Everyone else had gone home. It was just me and my newbie skills. The triage nurse listened and had the woman immediately taken back. The woman survived. I had been right. She did have an AAA. The surgeon later told her she would not have survived if I had sent her home. It was very close to bursting. She writes to me every year on the anniversary of the day I met her, saying I was the only medical professional who finally took her pain seriously and that I am her guardian angel. All I can say is thank goodness for differential diagnosis, clinical reasoning skills, and perhaps a really scared new graduate physical therapist. 6 years later, it remains a very proud moment for me, though I was just doing my job. Story 16. I am the spouse of someone who had a close call earlier this year. My husband had been complaining of a sore throat for a week, while I'd been moaning about man flu. I had taken him to his primary care practitioner twice, and both times he found nothing of concern, no visible inflammation, no temperature spike, and lungs sounded clear. On Friday night, he woke in the middle of the night with a stabbing pain in his throat. It took until lunchtime on Saturday to convince him that the next step was the emergency room. As per the GP's instructions, if things did not improve, since the ER had access to imaging that the GP did not. We went to the ER and waited maybe 5 hours to be seen. They performed some standard checks and were about to discharge him when the attending heard him speaking with a nurse while answering the discharge questions. The attending immediately ordered an X-ray. The next thing we knew, he was being transferred to another nearby hospital that had an ICU and an ENT ward. He had epiglottitis, and his throat was about to fully close. If things had progressed further, a cricothyrotomy would have been necessary. He was not allowed out of the medical staff's line of sight until handed off to the transfer team. He spent 3 days in the ICU while the swelling and infection were treated. We later learned that epiglottitis can present with a specific sound when speaking. The attending had only ever heard it once before, and we were lucky he recognized it as he walked past. Everything went from 0 to 100 in the blink of an eye. Story 17. I went to the movies with my sisters. One of them missed about an hour of the film because she had worked late and wanted to see it again immediately. I said I didn't feel well, but she talked me into going. We took separate cars to another theater. She later said I was restless throughout the movie, unable to get comfortable. She assumed my back was bothering me. When we walked out, I began to feel dizzy. We stopped, and I took a few deep breaths, saying I felt better. We were just steps away from getting into our cars when I collapsed from cardiac arrest. My sister and a bystander in the parking lot were both CPR certified and began resuscitation immediately. They performed CPR until EMS arrived and shocked me twice. I have an 8-day memory gap and spent 6 days in an induced coma, but I am one of the fewer than 10% of people who experience cardiac arrest outside a hospital and survive with all cognitive abilities intact. Had I gone home after the first movie, I would have passed alone in my sleep. Had I made it to my car, I would have been alone and possibly driving when my heart stopped. When I collapsed, my sister, though CPR certified, panicked, yelling at me and trying to wake me up. It was the bystander who came over and suggested starting CPR that helped her remember her training. I shudder when I think of all the small things that came together to save my life that night. If even one of them hadn't happened, I might not still be here. Story 18. I woke up one morning feeling like absolute garbage, almost like a hangover. except I hadn't had a drop of alcohol. My whole body felt off, but I tried to push through the day even though I could barely function. Coincidentally, I already had a doctor's appointment scheduled, so I forced myself to go. While I was there, a wave of nausea hit me hard. I asked the doctor if I could use the restroom, and as soon as I got there, I threw up a dark, gritty substance that looked like coffee grounds. That alone should have been a red flag, especially since I hadn't eaten anything. I had only taken some Advil earlier, hoping it would settle whatever was going on. After the appointment, I went home and tried to shake it off, but around 3 in the morning, my smoke detector started chirping because of a dead battery. I got up, grabbed a step stool, and as I reached up to fix it, I almost passed out. I tried again, same thing. I told my girlfriend, I can't do it, and went back to bed. The next morning, I tried to shower but had no energy. I ended up collapsing on the bathroom floor, completely drained. At that point, I knew this wasn't just a bug or exhaustion, something was seriously wrong. I went to the emergency room and explained everything, but the doctor brushed it off as a stomach virus and sent me home. I could barely function. Every time I tried to get up or move around, I felt like I was about to black out. The next day, I went to a family member's doctor, hoping for help. They wouldn't treat me and told me to go back to the ER. So I did. This time, I saw a different ER doctor who took one look at me and said, "You just don't look good. We're going to figure this out before you leave." That woman saved my life. It turned out that the combination of prednisone and Advil had torn up the lining of my stomach. I was bleeding internally, and my hemoglobin was at 5, dangerously low. I was ghost white, barely able to stay awake for more than a few minutes, and severely anemic. I was admitted immediately and given multiple blood transfusions. Looking back, I can see just how close I came to not making it. The exhaustion, the dizziness, the coffee ground vomit, all the signs were there. I just needed someone to truly listen. If that second ER doctor hadn't trusted her gut, I don't know if I'd be here to tell this story. 2016 tried to take me out, but it didn't. Story 19. My son is one of the few, I believe. He was sick with a cold and his breathing was raspy. He looked pale, and I, foolishly, wanted to drive to the farther hospital I was familiar with. It took some convincing to get my husband to agree that we should go to the emergency room at all. When we arrived, my son's color had turned a muted green. We were waiting in line at the ER when a triage nurse caught sight of him. She waved us forward to the irritation of everyone else waiting. She began my paperwork while clipping an oximeter onto his toe, then suddenly snatched the clipboard from my hands and rushed us to the back. Everything moved so fast. They were short-staffed, so they put me to work, holding things and talking to me to keep me focused. I remember the gruff nurse telling me to hold the oxygen mask tight to my son's face because the smallest one they had in the room was still too big. Then everything seemed to freeze. Someone quietly asked if I wanted a priest, saying they could call one to the room if I did. That's when I cried. But that gruff nurse sternly told me to hold the mask tight. Around that time, my son took a different kind of breath. Color started returning to his skin, and the gruff nurse hugged me. I heard her let out a sigh of relief, and I did the same. The smaller equipment they had called for finally arrived, and the tension in the room began to ease. At some point, they found my husband in the waiting room. He had no idea we had been brought back so quickly since he was with our other child that day. We were admitted to the hospital that night, the first of a few overnight stays my son and I would have together. He was diagnosed with asthma at 18 months old, a few months after that first incident. Most pediatricians refuse to make that diagnosis before a child turned 3, or at least they did at the time. He outgrew it years ago, just as his specialist said he would. But that first ER visit remains the scariest moment of my life. When they finally stabilized my son, that gruff nurse sat with me and cried. She told me she had been afraid it was too late. Then she got called away to the next patient who needed her. She and the triage nurse, I truly believe they're the reason things turned out the way they did. Story 20. When my partner was 22, she rapidly lost a stone in weight over the course of 1 month. Then she lost another stone in just 2 weeks. Her vision started to blur, and she had constant headaches, but she put it all down to fatigue from work. Her parents were about to leave for a holiday abroad over Christmas and New Year, but she could barely lift an empty cup. Before they left, they insisted she see her GP. The moment she walked in and explained what was happening, the doctor handed her a letter and told her to go straight to A&D. When she arrived at A&D, she handed them the letter and went to sit and wait. Almost immediately, a doctor came to get her and rushed her through to a bay. Her blood work was done right away. Her blood was essentially acidic. Her ketone levels were around 7.8 millimoles per liter, and her potassium levels were dangerously high. She was placed on an intensive insulin drip for about 4 days and told in no uncertain terms that if she had waited just one more day, she would have died. The doctors were astonished that she was even awake and talking with those levels. 10 years later, she manages her type 1 diabetes reasonably well, and every day I'm grateful to her parents for refusing to let their child deteriorate while they were on holiday. Story 21. I work the front desk at an emergency vet, and while we're not medically trained to the same level as a veterinary technician, we all have basic medical knowledge since we're responsible for triaging. A few months ago, a senior Aussie came in after experiencing a few episodes of collapsing at home. She presented fairly well, walking in on her own, alert and responsive, panting a bit, which is common in nervous dogs. Based on her presentation, she didn't meet the criteria for a stat triage, which means everyone drop everything, run to the lobby, and get this dog in front of a doctor immediately. I triaged her as an urgent level, meaning she needed to be seen soon but wasn't actively dying, and asked her mom to take a seat with her for a few minutes until the technicians could come take her history. As I finished checking in her mom, she mentioned that the dog seemed like she was about to collapse again, so I went back to grab a technician to fast-track her triage. At this point, they had probably been in the clinic for a total of 3 minutes. As we returned to the lobby, the dog collapsed, went limp, and stopped breathing. The technician scooped her up and ran to the stat table, and the team immediately began CPR. For the first and only time I have personally witnessed in the 2 years I've worked at the clinic, CPR was successful, and they had her back within a few minutes. CPR in animals has a significantly lower success rate than in humans, and if the dog had collapsed even a few minutes earlier, she likely would not have survived. On a happier note, she was discharged the next day with a referral to a cardiologist and has not had to return to the ER since. Story 22. I was pregnant with my second child and my mom was succumbing to cancer, so I quit my job when they told me she had 6 months left. I was also diagnosed with preeclampsia, which made my pregnancy high risk. One day I went for an ultrasound alone as it was during COVID and my husband was at work. They told me my baby was very small and there was concern it could be dwarfism. I called my husband and he left work immediately, taking the next day off as well. The next day, I was supposed to meet my midwife at 2 in the afternoon to go over the ultrasound results. But something felt off. My daughter wasn't moving much, and I had a strange pain like I needed to pass gas but couldn't. I called my midwife and told her I wanted to come in earlier. My husband drove us, and we were about a minute from the hospital when I suddenly felt liquid in my pants. I put my hand there and saw blood. Then, all at once, it gushed out, just like in a movie. My husband ran a few red lights and got us to the hospital. Thankfully, because of lockdown, there were nurses at the entrance checking temperatures and vaccination records. I don't remember much after that, but they performed an emergency C-section and told me I had lost about 2 liters of blood. They said if I had been at home, or even a few minutes farther away, neither my baby nor I would have survived. Story 23. I was talking to my mom when, all of a sudden, I felt like I was going to collapse and saw my skin turn gray briefly. I drove myself to the hospital. In my defense, I didn't know any better at the time. I had planned to go to our preferred hospital, but when I nearly passed out walking from the car to pay for gas, I knew this was serious. I ended up driving to a hospital a little further away because the other 2 options weren't really viable. One hospital was owned by the initial hospital I had considered, which has a bad reputation, and the other would have been too difficult for my parents to navigate driving to and from. I was triaged and waited for a while. It was a busy day. I described what had happened, but I felt like no one was really listening. As soon as my blood work came back, though, I was immediately rushed to the ICU. Multiple people ran alongside my bed, and I was completely taken aback by the scene. The next 24 hours were a blur. The following morning, one of the cardiac ICU doctors told me he had never seen anyone alive with so many clots in their lungs, compressing the heart. He was genuinely surprised I was still alive. Story 24. I'm a psychiatrist, so we don't encounter a lot of near-death cases, but one incident from residency stands out. I was on call one night when I received a call from an outpatient of one of the attendings in the clinic. The patient's wife explained that he had recently started a new medication, wasn't feeling well, and just wanted to make sure it wasn't serious, apologizing for bothering me. When I reviewed the patient's chart, I saw that he had a history of liver issues and was currently being monitored and treated for cirrhosis. The medication he had recently started was known to be hepatotoxic, meaning potentially damaging to the liver. In hindsight, the patient's doctor should not have started that medication given his medical history. I discussed the situation with his wife, who reported that her husband had been feeling ill, vomiting, weak, and experiencing abdominal pain. When I asked further, she mentioned that his skin and the whites of his eyes were yellow. She also noted that he had been showing progressive confusion and seemed out of it. I instructed her to stop giving him the new medication and to either go to the nearest emergency room or call 911 immediately. She hesitated, asking if it was really necessary since they were already in their pajamas and planning to go to bed soon. She wondered if they could just go to urgent care in the morning. I told her plainly, "Ma'am, if that were my father, I would either be on the phone with 911 right now or getting in the car to bring him to the emergency room myself." She seemed to take that seriously and said they would get dressed and go immediately. I checked the patient's chart about 1 to 2 hours later and saw that, thankfully, his wife had brought him in. He was immediately admitted to the ICU with acute liver failure. His exam findings and lab results were alarming. Had he and his wife gone to bed with the plan of going to urgent care in the morning, he likely would not have survived. Otherwise, I've definitely heard my fair share of patient stories about being on the brink of death when they weren't, experiencing things within healthcare that would never happen or are impossible, or receiving labs, exam findings, or medication doses that are intended to show severity, but often do the opposite. Most of the stories I've heard about people claiming they woke up during surgery seem highly exaggerated, if not completely made up, based on how operating rooms are set up and how surgeries are performed. I've had numerous patients sit down in front of me and say things like, "I'm probably the worst or most screwed up person you'll ever meet," or "You're probably wondering how I'm even still alive right now," or claim they've gone through the worst trauma I've ever heard of. In every case, they've been wrong. The patients who are truly the most troubled rarely consider themselves so. The most severe traumas I've heard about often come from patients who don't dwell on comparisons. There are certainly patients who amaze me just by being alive, but none of them boast about their suffering as if there were an award for it. Story 25. Around 9 in the morning on December 2nd, my mom went in for a pregnancy checkup and was told she needed to be admitted immediately and induced, or she and I would die within the hour. "You will have a stroke and pass at any moment," the doctor warned. She didn't listen, since she had 2 other kids and a husband who couldn't leave work. She went home and basically lay on the couch trying to stay calm and keep her blood pressure from rising. She went to the ER the next morning, where her OB was waiting. She was injected with medication to start labor, and I arrived after just 3 light pushes. The doctor had to catch me with one hand. I spent a few days in the NICU because I was a preemie, and my mom needed a little observation, otherwise we were fine. She's an unreliable storyteller, but she tells it as if she was on the verge of dying and actively fighting the Reaper himself. Obviously, she was in trouble, but not nearly like that. My mom had preeclampsia throughout the entire pregnancy. My dad had to go on a business trip and would have missed the appointment, so she moved it up a few days. When they went in, there wasn't enough amniotic fluid to perform an amniocentesis. I was apparently in serious trouble, and they performed an emergency C-section within the hour to get me out. Both of us were in rough shape. I don't remember the exact numbers, but our chances of survival were less than 50%. We both came through it fine. But the doctors said that if she hadn't gone in when she did, I definitely would not have survived until the original appointment. I was more than 2 months premature, spent a month in the NICU, and was finally able to come home. Story 26. I'm in the UK, and I'll often say to patients, "I'm glad you came in or you left this to the last minute," but I don't mean it literally. When it's truly touch and go, people usually do lose their pulse. Plenty go into cardiac arrest in the ambulance or while being wheeled in. I've never had someone come in peri-arrest and gotten them immediate treatment where I thought, phew, that saved them from the brink. That said, some patients do have remarkable responses. For example, someone with a known aneurysm collapse might have an ambulance on scene within 3 minutes. They notify AAND that they're coming in, We alert the vascular team, and the theater staff is prepped. The patient spends about 7 minutes in our department getting blood tests, including transfusion match samples, a cannula, consent for surgery, and even a handshake from the surgeons before being wheeled upstairs and surviving. In situations like this, every minute counts, but I'm never thinking 1 minute later would have been the last minute. Story 27. My gallbladder went septic. I had been experiencing gallstone attacks for the previous 2 years. They were so painful that I started keeping a log of each incident, though I had no idea what was causing them. Each attack felt like I was dying for about 45 minutes. Then the pain would vanish just as suddenly as it came. After running a fever over 101 degrees for several days, I finally went to the doctor, who performed an ultrasound. I was about 6 hours from home when I got the call. My gallbladder had gone septic and needed to be removed immediately. I drove 4 hours to another town and checked into a hospital where we knew one of the surgeons, the same one who ended up performing the operation. He told me he had been very close to opening me up fully to remove all the infection. What should have been a 30-minute surgery turned into a 2.5-hour procedure because he opted to do it laparoscopically. Even now, I still don't fully grasp how close I was to sepsis. Story 28. We had an older gentleman on our search and rescue team who was managing a helicopter landing zone. This involves sorting out the order and directing each team. He went from feeling perfectly fine and asking us to take a quick look at him to experiencing crushing chest pain and becoming pale, cool, and clammy in about 5 minutes. We put him on oxygen and called down to the command post for help, checking on the status of the helicopter. They made the appropriate calls and updated the helicopter crew about the situation. About 2 minutes later, the airship we had been waiting for all morning arrived. Luckily, it was staffed with a full advanced life support crew that day. The medic attached a monitor and said, "Yep, full right-sided heart block." They administered several medications, secured him, and rushed him to the nearest hospital, where he received 3 stents. He was discharged and doing well just 2 days later. Had this happened during the car ride up, he almost certainly would not have survived. Story 29. I had a triaged, not-so-fit man in his 60s who complained of anterior chest pain after lifting weights on his Chuck Norris weight bench. We were swamped, so I checked his vitals. They were normal and put him in a fast-track bed, assuming he'd pulled a pec. However, he mentioned some cardiac history, so I told the doctor I'd run an EKG just for fun. Suddenly, his heart rate dropped to 37 and he looked a bit gray. Full workup initiated. The EKG was normal except for bradycardia, and cardiac enzymes were okay. We're a small hospital, but our consulting cardiologist knew him and agreed to admit him, though he suggested we do a CT angiogram to rule out a pulmonary embolism. As I watched the images on the screen, I saw his aorta suddenly balloon, a massive bulge because he was dissecting from the arch all the way down into the abdomen. I've never rushed a patient from CT that fast in my life, and I prayed the helicopter would get there in time. He was on the table at the tertiary care facility within 25 minutes, and they saved him before it could rupture. Story 30. This happened before Uber and 24-hour urgent care centers were common. I was called out for an unknown medical around 3 in the morning. When I arrived, I found a woman in her late 40s, dressed and sitting in the lobby of a condominium building. She was staying at a friend's apartment for the week and didn't have a car. She was embarrassed that she had called 911, but she had been experiencing terrible indigestion since 11 p.m. and feared it was food poisoning. We loaded her into the ambulance, took her vitals, and she mentioned that the discomfort didn't improve or worsen whether she lay down or sat up. In EMS, that's a red flag. 99% of the time, it indicates a cardiac issue. We hooked her up to the EKG, and she was showing tombstone ST elevations. My partner and I looked at the monitor, exchanged a glance, and both muttered. We started 2 IVs, gave aspirin and morphine, and rushed her to the nearest hospital with a cath lab. When we arrived in the ED, the cardiologist was already there. He glanced at the monitor, asked a few questions, and we took her directly to the cath lab, where she coded. We got her back after 1 shock, stabilized her, and the team proceeded with the catheterization. I later heard she did well in the cath lab and made a full recovery. Thank you for watching. If you enjoyed this video, be sure to give it a thumbs up, subscribe, and hit the bell icon so you never miss an update.